Several people have asked me to make a video about a condition called Autoimmune Hemolytic Anemia, the acronym AIHA. And it's a lot like the condition I was diagnosed with, ITP, in many ways, both the symptoms and the treatment. And so today I'm going to respond to these requests and share with you what is hemolytic anemia, what is a normal experience of somebody having this condition, and finally, what are the normal treatments? Especially since I am the Prednisone pharmacist, that will definitely take its place. So the first request I received was from someone in a YouTube comment. She said, "Can you make a video about prednisone on AIHA patient? My 5-year-old daughter was diagnosed with autoimmune hemolytic anemia last year, and she's on steroid therapy for 9 months already. And right now, she's suffering from vertebral compression fracture. Thank you." She's 5 years old, and she has the spine of an 80-year-old now because of this treatment. The little hunched over grandma neck is what this little 5-year-old is dealing with. Compression fractures. Her spine is squishing itself because of the bone loss from the prednisone. That's horrible. So what in the world is this thing that this little girl is suffering with? Well, autoimmune means that your immune system is attacking a part of you. And the hemolytic means that the parts of your blood cells that have heme or iron, the red blood cells, are being lysed or lytic, being destroyed. Your immune system is destroying your red blood cells, and that's leading to anemia or low levels of oxygen in your blood because you don't have enough iron from not enough red blood cells. And so essentially, a person with this condition is probably feeling exhausted, gets out of breath quickly, might have heart palpitations, and other general symptoms of anemia. Potentially, it can change the color of your eyelid inside, or your skin can be different. It can actually, in certain cases, change your temperature. So a child might be really cold. There's several different aspects, potential ways it can show up. But in general, it's an autoimmune attack leading to anemia. And so that means your doctor needs to check a lot of things, lots of blood tests. And these are the most common is obviously going to be the hemoglobin, which is the measurement of the amount of that specific protein in your blood that is reflective of the amount of iron and iron carrying capacity that you have for having enough oxygen. And if that's low, then you have anemia. Normal for most people is somewhere above 12 to 13. And I'm going to tell you the story of the next person. And this is the husband of a woman who called me in last week. And she told me the story of her husband, how he had a blood test and his hemoglobin had dropped to 7.4. That's nearly half of what it's supposed to be. Luckily, he had been seen quite quickly after the blood test by a doctor who said, "We need to get you in an ambulance to the emergency room now. You are at risk of having a fatal event, whether it's his heart not being able to beat properly or just whatever cause of anemic death." And that is horrible. So luckily, they rushed him to the hospital, gave him transfusions, and he was given blood to replace what was missing. But what's tricky about autoimmune hemolytic anemia is that your immune system is still going to attack those red blood cells, even if they're foreign ones that were transfused from a blood donor. And so there used to be a question, do we give those people transfusions or not? And the answer is yes. Generally, transfusions are warranted. We don't want people dying of anemia. And so that's often the first option is give them a transfusion of blood donor. Then there are several types of autoimmune hemolytic anemia, and I'm not going to focus on the cold kinds. Those have different treatment plans. I'm going to focus on the kind that are most responsive to prednisone therapy. So for these conditions, after they're out of the danger zone of low hemoglobin levels such as 7, and lots of other tests have been given to rule out potential causes. It could be Epstein-Barr virus, it could be mono, it could be many different causes could lead to this condition. And so we got to figure out if it's a reversible cause that is treatable, can we find that cause and treat it? Because that will treat the hemolytic anemia. So they have to do tons of tests, and I don't want to go into depths about all of those tests, but essentially the doctor's job is to find out if it's caused by one of those main causes and then rule out as many as possible, because then we don't have to dive deeper into the other treatments I'm about to set forth that are less pleasant. So after the transfusion, they usually start prednisone or another steroid, solumedrol, or other intravenous types of steroid treatment. And these, like that first story talked about, can cause horrible side effects. That little 5-year-old having compression fractures. It's terrible. And up to 150 side effects can be attributed to prednisone. And so this is not something we want to do without definitely needing it. But in this case, it's either the autoimmune condition destroying your blood or side effects. Death or side effects. It's really a tricky decision. And that was really similar with my condition. My autoimmune condition was attacking a different cell called platelets. Same story. Prednisone is the first treatment choice. And hopefully that's enough. Hopefully that lets the immune system kind of reset and turns off the crazy responses it's having, this autoimmune attack of itself. And if it's not, then we have to escalate from prednisone to other treatments. The next one is the one I personally actually did use, which is a form of chemotherapy or immunotherapy called rituximab, or brand name Rituxan. This helps the autoimmune to disappear. It's affecting the B cells and just kind of remodeling the immune system temporarily. And it is thankfully what put me into remission for my condition. So that's the next option. If that doesn't work, then they escalate it to other drugs that have less efficacy, and maybe they work, maybe they don't. It's kind of at that point just throwing darts at the wall or some spaghetti at the wall and seeing what sticks. And these are things like azathioprine or methotrexate. Just see, is there anything we can do to get this autoimmune condition to stop attacking? And so those are the main treatments of autoimmune hemolytic anemia. And luckily for my older gentleman with this condition, his is finally reversing and he's finally able to get off the prednisone. And now he's just worried about the long-term consequences of prednisone. And if you are worried about the long-term consequences of prednisone, then you need to download my prednisone checklist. It has the top side effects of prednisone and what you can do about them, because you don't have to just suffer them. There are things you can do to detect them and counteract them early so that they don't affect you permanently, like this poor little girl with her compression fractures. So just click the link below to download your prednisone checklist now. Signing off is Dr. Megan, your prednisone pharmacist.